can show you other branches here. Okay, so, all right, so this is the graph that Dr. Oyer first put in, right? Your heart's down here.
Yeah.
And this is the graph that Dr. Oyer first put in, okay? These are the branches that feed the heart. So those are fine. All that portion is fine. And then the graph, this graph from there to there, okay? That's the second graph that Dr. Oyer put in, right? And then so what's left of you is from here to there and from there down, okay? This portion down here seems to be quite stable, okay, over the past year. Biggest area here is the area right in here, this area here, where it measures 54 by 48 millimeters. Okay, so about 2 inches.
Okay.
Okay, so we typically wouldn't do that area until you got to about 6.5. Okay, and it's been pretty stable. So hopefully we can. That'll be a long time before we have to do anything. Maybe never. Okay. So the issue are these guys. This one right here. This is the carotid that goes up to the left carotid. Okay, see how it's kind of, normally it should be this, like this size over here. So see this big sort of balloon right there.
Yeah.
This is the normal size up here.
Look at it, babe.
Oops. Okay.
You know,
And
you
then
interrupt your anatomy.
Your Grey's Anatomy Kuwait.
this is real anatomy, not
Yeah.
Grey's Anatomy. This is your mom's anatomy, okay? So this is the arch, right? That's where the blood goes up and turns around, heads down, right? And these are the branch vessels. This is the branch that feeds the left side of the brain. You can see this sort of sausage. Okay, it shouldn't be a sausage. It should be a little tube like that. This little sausage is the one that feeds the left arm. Okay, it's not as big. This is the one that's in some ways the most concerning. It's about 2 millimeters bigger than before. And then you can see over here, it's a little harder because it's hidden underneath the bone. You see this little sausage down there. This is the branch that then, this one right here, the branch right here, gives off the branch that goes up to the brain on the right side. Okay, and also the branch that goes to your left, the right arm over here. Okay. So, you know, the strategy would be to go in and replace from here to there with a graft that has little branches coming off, off of it. And then basically attach it up here, attach it down there, and attach it to these branches. So basically get rid of all these parts of the little sausages all up there. Okay. So what does that involve, right? That's the famous last words. What does it involve?
Yeah.
Unfortunately, to get in there, we have to come in from the front again.
Okay.
We're going from the front to do the operation. To do this operation, when they're doing the operation, they would cool you down.
Make me cold.
Yeah, very cold. Okay, really cold. Okay, and the reason for that is that while they're working on this, they have to decrease the blood flow to the brain, right? Because they need to open up the blood vessels to sew to it. If they let the blood flow normally during that time, well, lots of blood flying everywhere. It's really hard to sew, and you bleed out really quickly.
Yeah, earlier.
Yeah. So, so what they do in this is they cool you off so they can actually slow down the flow going to the brain. Okay.
So it's pretty much like what they did before.
Yeah.
Okay.
Ice cold. Okay.
Okay.
We have some better techniques, so we don't have to go quite as cold as we used to because we keep some blood flowing still in the procedure. Okay. So and then you know what the recovery is like for this. Okay. The primary risk. Okay, your heart is fine. The spinal cord is not going to be an issue. The primary risk is of stroke while they're doing this because obviously they're working on the branches that go up to the head and stuff like that. I'd have to talk to Dr. Fishbein to get a sense of what he would quote, but you know, I would guess that the stroke risk of this would be maybe a couple of percent.
Okay.
You know, hopefully most of the strokes would not be big strokes where one side doesn't work.
Yeah.
But that is possible. Okay. More likely, if there's a stroke, it'll be a smaller stroke. That would be probably some sort of deficit. But most likely is that you wouldn't have a stroke because we'd be doing a lot of things to protect you. But there is that risk of stroke. Okay. So
what's the recovery time on that?
Recovery for this?
Yeah.
We're similar to the recovery from this. Although it's hard to know because you were in the hospital the whole time after that.
I was for a while.
So usually, sorry. Hello, David.
That's crazy. I want to take a picture of that.
Hi, Corey. Did you send over did you upload the images? Oh, okay. I didn't get any notification about it. Okay, I'll get them downloaded and uploaded in the packs and get radiology, get the orthopedic surgeon to look at it. I checked with Dr. Rinsky and he recommended Dr. So, I'd have to talk to the surgeons to put their real sense of what the risk is from this in terms of this. In terms of recovery, the usual about a week in the hospital.
Okay.
Okay, and then when you first get home, you're tired. Okay. Probably for a couple weeks, and then things start getting better pretty quickly after that. And about 3 months or so after surgery, you're back to where you are right now. Okay. So in terms of what sort of help do you need at home and stuff like that, when you first get home, you're up and walking about. You're not going to want to cook. You're not going to want to do dishes or laundry and stuff. That's you. Okay, listen. You're gonna put the earphones on overhead. So you're gonna need to help out with that period of time. Okay, but by about 2 or 3 weeks afterwards, you're feeling pretty good. Okay, we're gonna be getting you out and walking every day anyway. But by 2 weeks out, at that point, most people are not feeling a lot of pain. Okay. And they're moving about. They're still tired easily, so you'll still need to have somebody help you, with the grocery shopping and stuff like that. By about 4 weeks, you'll begin to be able to do some of the, home chores. And by 6, you just tire easily, but you'll be able to do mostly everything you need to do. Okay.
When do you recommend to do this?
Okay. Well, and this is a bit of an art. Okay. It's been a slow, steady growth. This discomfort you have, I'm not sure if it's coming for this.
Okay.
Okay. I don't think so. If it had been coming from the left side, because the big one's on the left side.
Yeah.
And so I would have been a little bit more worried that maybe this was more likely just muscle than anything. Okay. So if we don't do anything, I would suspect that within a year or two we'll get to the point where I say you have to do it.
Okay.
Okay. At this point, it would fall in the category. Okay. There's some risk in waiting, okay, but they're sort of balanced the risk of surgery versus risk of waiting at this point.
Okay.
Okay. At some point, I get to the point where, okay, I'm not going to give you the option anymore.
Yeah.
Okay. And so this is sort of time where it's, okay, where does it fit for you, Chantel, and everybody else at home as to what the right time is, okay, with respect to school and work and everything else.
So my thing, should this limit like some of my stuff we do, or
what are you doing right now?
Like because
we need to do a lighter cage thing because I can't.
Because how we go to Disneyland, things like that.
Okay. Well, Disneyland is getting rougher. It used to be pretty tame. It's not, the rides aren't so tame anymore.
Well, I don't go on like the roller coaster like at California. I don't do none of that. But we do the ones at
Disney side. Oh, yeah, that's fine. Go for it.
Oh, okay, yeah, because I don't do nothing over there on California.
Yeah. Although I guess didn't they just revamp Disneyland? Like Tomorrowland or something like that got revamped.
Yeah, they do some of
But I don't think any of them are that much throw you around. It's more sort of visual stuff.
Yeah,
like
we do Disneyland and we do Universal, but so that's why I just want to make sure.
Yeah, no, that's fine. I should enjoy that. I wouldn't worry about it. The California side, there are a few rides like.
Yeah, I don't do nothing. I don't do none of that stuff over there.
Great idea.
But and then I mow my lawn. I do stuff like that. Okay. I do a lot of that kind of stuff.
It's not you have a powered mower, right?
Yeah.
Yeah. Okay. Yeah, it's fine.
Yeah, I do.
Yeah, you're not that fragile. Okay. If you were that fragile, I'd just tell you the operation done.
Yeah.
Okay.
Just want to make sure because a lot of the stuff I do that stuff and then I'm tired. I'm things like that. So that's why I just want to make sure because Yeah,
pace yourself. Okay. Listen how you feel, how your body feels. Okay.
Oh yeah, because the other day we were out doing yard work, and I started feeling like just pains in my stomach, and I just went and I laid down because I I could feel when my body starts hurting and stuff like that. So so, but I just want to make sure.
No, I don't think you're that fragile.
Okay.
I do want to run this by Dr. Fishbein.
Okay.
Okay. And see what his feeling is because he would be the one to do this operation.
Okay.
Okay. I could show it to Dr. Oyer too as well, but this is not his forte.
Yeah.
It's not what he does on a regular basis.
Yeah.
But I'll show it to him anyways because he knows you're inside well.
Yeah.
You did a pretty good job with the other parts.
Right.
But I want to run this by Dr. Fishbein in terms of, and getting what his sense is of the risk if we leave it alone, what his sense is in terms of risk of surgery.
Okay.
And then I can give you a call back and we can discuss it some more.
Okay.
But I don't think it's an emergency. I'm not going to pop you in the hospital right now or anything like that. Okay?
Yeah.
So, all right?
Alrighty.
Okay.
So other than that, everything's pretty good.
Yeah, so the other things are pretty stable. It's just this area here is sort of like, it's getting to the point where I'm wondering,
Okay.
I'm going to go ahead and remeasure also later today just to make sure that I'm comparing the measurements I just got now with the numbers I got last time I saw you.
Okay.
And I usually like to go ahead and remeasure them side by side again. I haven't had a chance to do that yet. So I'll do that and I'll give you a call I'll give you a call tomorrow because you have to drive home right now.
Yeah.
So I'll give you a call right tomorrow and after I've had a chance to talk to Dr. Fishbein
Alrighty.
and get his opinion about all this. Okay?
Alrighty.
All right? Okay.
Sounds good.
Good. I'm glad to see your blood pressure so much. I haven't seen your blood pressure that good in a long time.
I know, right?
That's great. That's fantastic.
Yeah.
All right. Good. All right. Other things that are treating you okay?
Yeah.
Okay. And your relatives, how are they doing?
My mom's been kind of